Welcome to Safety Provisions, home of the Hard Hat Training Series. Today, we will be discussing mental health first aid. This is a topic that is misunderstood and surrounded by stigmas. Today's training will give you the knowledge and tools that will help you recognize and understand some of the more common of these issues and empower you to take action. Mental illness is commonly used as a blanket phrase when referring to all mental disorders. These disorders involve changes in emotion, thinking, or behavior, or a combination of these. Mental illnesses usually lead to distress and difficulties functioning in social, work, and family settings. Mental illnesses are health conditions, and many are treatable. In fact, the vast majority of those suffering with mental disorders hold down jobs, take care of their loved ones, self-advocate, and offer valuable contributions to their community and society as a whole. More than just the absence of mental illness, mental wellness revolves around a person's capacity to manage their thoughts, feelings, and behavior. It is the foundation for your emotions, thinking, communication, learning, resilience, and self-esteem. It is also the key to healthy relationships. When you are mentally healthy, you have a sense of psychological well-being that helps you realize your own abilities. It allows you to cope with everyday stress, work productivity, and contribute to your community. A common myth in today's society is that mental disorders are rare and won't happen to me. Don't fall into this trap. The truth is, mental health disorders are widespread. While the exact numbers may vary from source to source due to differences in reporting practices, it is estimated that about 44 million Americans suffer from mental disorders. That's 1 in 5 adults. Depression and bipolar disorder are the third most common cause of hospitalization for both youth and adults. The cost for treatment, social services, disability pay, lost productivity, and premature mortality is more than $15 billion a year. These statistics are alarming. However, they serve as a reminder that mental health affects all aspects of life, including physical health and well-being, not only for those suffering from mental health issues, but for their families, co-workers, and community. Take, for example, a young man we'll call Stephen. Stephen struggled with depression for much of his life. While he was funny, kind, and empathetic, he didn't see himself that way. He couldn't control the negative thoughts he had about himself. He doubted his ability to be a good father, son, and friend. He battled these feelings of inadequacy constantly. When his brother passed away, the trauma of his loss only compounded Stephen's depression. While he reached out occasionally to close friends and family members for support, Stephen didn't seek medical assistance. He was worried about what his friends and coworkers would think of him if they knew he had depression. He suffered largely in silence. Unable to recognize how important he was to the people in his life, Stephen killed himself. His 8-year-old son, wife, friends, and coworkers were all left to wonder what more they could have done for Stephen. Some didn't even realize he had a serious mental disorder and wondered what signs they had missed. The most repeated phrase at Stephen's funeral was, "If I had known, I would have helped." Unfortunately, Stephen's story isn't a unique one. It plays out every day across the nation and around the globe. Think about the people in your life. Do you know a Stephen? Do you know someone who is struggling but is afraid to ask for help? Are you missing the signs of a mental disorder?